Okay, so that was my doctor. It's like you get so many phone calls from specialists, doctors, nurses, advocates, patient advocates, insurance. It's almost like that is my job now, which is okay. It's just not my favorite thing, dealing with all of the doctor questions. And actually, patient advocates have been great. There's a lot of great resources out there that I suggest people use. You should use the things around you. The people that want to help you really do want to help you. So sometimes it's hard to accept the help, but you got to learn to let go of some things and accept the help when you need it and where you need it. So I guess that's just my first video talking about, I don't want to call it my cancer journey. I think everyone calls it a cancer journey, and it is. I don't want to call it a battle, but I do feel I'm at war sometimes. It's just my cancer diary. So I'm going to talk about that, and actually just a diary maybe in general of, how I'm doing from day to day, or if something changes, or if I feel like there's something that I want to say. Like I said, I don't even know that I'm going to put this out there. I just kind of wanted to do it so my kids could see it, or that other people could see it. I hope that I can bring hope to people that have cancer or disease. And I want to bring the word of God to people, because God inevitably is the source of everything and the meaning of it all. So I was never mad being diagnosed with cancer. I was obviously upset, but I really never did the why me thing. Maybe for a second I did. Maybe in the hospital I was like, why me? Why would this happen to me? But why would this happen to anyone? Why would cancer happen to children? Why would cancer happen to babies? I mean, St. Jude is full of children with cancer. And so we can't ask that question. I mean, you can if you want, but that's not the important question to ask. We're all here living our lives, and we all get things. We get diseases, we get illnesses, we get a lot of things in our life that we have to deal with. And I think God put this in my life for a reason. And I know He did. I know that He did, because the road that I was on, I don't know that I could have done it much longer. I was just, I can't even say stressed out. I don't like people say they're stressed out, but I had a lot. I had a lot on me. And I just felt like I had to keep doing and doing and doing and doing. And I worked more and more and more. And as my kids got older, I thought, well, now I can work even more because my kids are older and they can do these things without me. They know how to drive, or, whatever. And so I just kept putting more on myself. And I think God was like, you know what, you need to stop. You need to reevaluate your life. You need to reevaluate what's important and who's important. And I actually can say that I have done that since being diagnosed with cancer. And I think I live a more purposeful life now. And it really is about the quality. It's not about the quantity of time that we have. Like I said, no one knows when they're going to go. I do have cancer, and I could still get, in a car accident and pass away, or any kind of other accident, or something else could happen to me, or something else could happen to somebody else that I love. So that's not the way to look at it. The way to look at it is to really squeeze as much of every day that you can out of it. You need to squeeze it all, and just appreciate those around you. Be grateful for the things around you. Look at everything as a learning lesson. Even the negative things in life can be a learning lesson to us. And I struggle with that. It's not, I'm saying I do it all the time, but I've gotten better at, not getting at my kid, mad at my kids for the little things, or my husband for the little things. Although I'm sure we still annoy each other like normal. But not letting it get to you to a point where you're mad, or you're staying mad, or being angry, because it's truly not worth it. It's really not worth it. And I will say that anyone that probably has cancer or another illness that makes them face their mortality could probably agree with me that it's just not worth spending any extra energy on the negative. It's just not worth it. You got to see the good in everything, or you got to try to make it, turn for your good, and know that God has you right where He wants you, and He would not put you in this position unless, number one, you can handle it, and number two, that He already knows He knows the end. right? He already knows the ending to your story, my story, everybody's story. And so he wouldn't put it on you, but he did it for a reason. And so finding that reason is what has been my driving force, maybe, is to figure out not why this happened to me, but what is my purpose, right? What is my life's purpose? What is my goal? What are my goals? And do they honor him in those things? So with that, I've been trying to live my life that way. Maybe like I've been volunteering a little more through church, and I do it when I can. I really would like to do it more, but it's been hard for me. But I do volunteer. We work with another local organization that gives food to the homeless, and so I cut hair for the homeless sometimes, which I find really awesome. It's really been a great experience. I would like to maybe volunteer at our local pregnancy center, where we educate women, girls, whoever, about non-abortion choices for their pregnancy, and counseling if they keep their pregnancy, which is wonderful. So I'm trying to expand myself in those ways, and even in the little things in life, honor God in those things. By spending more time with my husband, or more time with my children, more time in nature, which I think is really important. There's a lot we can do that's not medicine, that's not a pill, to help ourselves. Like I said, go for walks, meditate. And I know this stuff sounds like, oh my gosh, like I'm not gonna, meditate, but then 5 minutes a day, just in quietness, even if you're not doing all the other things, just focus on breathing and focus on positivity. That's really important. It's very important. The Radical Remission audiobook is amazing. She puts through all of these remission stories and the things that they did that they had in common from all walks of life. So, and it can be combined with your regular therapy, your regular medical therapy, and then the natural therapy. So the natural doctor that I'm seeing, like I said, she has me on metformin to lower my blood sugar. She has me on doxycycline, which is an antibiotic. She has me on mebendazole, which I know people take the fenbendazole. That's for animals, and so I was researching that as an option, and so she put me on the mebendazole. And then I take naltrexone, which is Narcan, which they give to patients who are overdosing from opioids. There's evidence that Narcan can have some really good effects on people with cancer. So I'm taking all of those. I take a lot of supplements also that were... I was taking them before I actually got recommendation, just on things that I had read. And so now I'm taking the ones that she also recommends, which is seed. Seeds are really great, pre and probiotic, so I take that. It's in a little green jar. I take curcumin. I take resveratrol. I don't know the milligrams or the amounts. I can look it up. I could look at it and maybe do an update later and tell you guys what amounts they are. I take calcium for the bones because it needs to be readily available for my bones. Because the cancer, I don't think I even said this in the video. The cancer is in my sternum, areas of my sternum, which is why I was having pain there. And then, obviously your sternum is here, but your spine is really close to that, behind. And so I have some areas of cancer lesion, maybe, on my thoracic region of my spine, the middle of my back, and then lower lumbar, like L5, I think. And I had that PET scan that showed all of that a while ago, back in July, I think. And I just had another one. So July, August, September, October. I think she wants to do a PET scan like every 3 months. Okay, so I just had one done in October, another one. And the results were really great. I mean, the areas look like they're getting smaller, more manageable. So that's good. The areas that were really dark on the PET scan, like I can read a PET scan, but she was showing me side by side because I don't know what I'm looking at. Was that it was really dark in the beginning, and now those areas have gotten lighter. And so I'm going to keep doing what I'm doing. I'm going to keep doing the medicine that she's prescribing, but I'm also going to keep doing what I've been doing, which is trying to work out, going for walks with my husband, going for walks with myself, walks with my dog, trying to work out with some weight-bearing exercises. I was very weak uh, 4 months ago, and I couldn't even bend over to pick something up. My back was just, I felt a weakness in my legs and in my back, and that's probably because of the cancer. But now I don't feel that, so I get tired more easy than I used to, which is aggravating for me because I don't like that. Who does? So I just do what I can do when I can do it, and I've been following that. I know there's other supplements that I take, magnesium at bedtime, melatonin. She put me on melatonin, quercetin, and there's a couple other ones I think that I can take on and off. But for the most part, that's what I've been taking. If anyone has any other things that they've taken that have worked for them, please let me know. I'm open to anyone's comments and suggestions, and you can't hurt my feelings, so you can say whatever you want. I don't hear it when I when I look like this and I don't have makeup on. No one really says, hey, you look really great, like you don't have cancer. But when I do get dressed and do my hair and my makeup, people usually say that I don't look sick, which is great. I'll take it. I don't want to look sick, so that's fabulous. But I also feel like I always put a lot of emphasis on the way I look because I'm a hairstylist, and so you kind of have to. You have to play the part. You have to look good. Your hair has to look good. And so that's been hard for me since my hair has gotten kind of, I'm going to say different. I'm not going to say thinning. I'm not going to put those words out there because I'm trying to stay positive. So I'm just going to say my hair has changed. And so I have cut it several times from about here down to about here, and I might take it up to my shoulder. We'll see. I don't know. But besides that, I'm just keep it on. So if anyone has anything they want to say, please feel free to. Let me know, what you're doing, where you're going. I would love to hear anything you guys have to say about it. And I wish everyone the best. I'm wishing everyone good health. Isn't that funny when you're young? You hear older people say, if you have your health, you have everything. And it's like, okay. But it's really true. If you have your health, you have so much, because you have this inner, feeling that you're okay, that you're competent, that you can do things that you want to do. And so that's really important to me. And I'm not going to say I'm unhealthy because I have cancer. I don't feel unhealthy, and I don't feel like I am unhealthy. I feel like I don't like that C word. I just don't like it. I know that's what I have, but I don't want to talk about it. I don't want to say it. I'll just say that I've got a mass of cells that are dysfunctional in my body. These cells don't want to work with the other cells. They want to be rebels. They want to be bad cells. Makes sense. Goes with my personality, I guess. So I'm just gonna say they're these funky cells in my body, and that's caused disease, right? Dis-ease in the body. And I'm gonna do everything I can to right that, to get that out, to get it gone. And even if it's never fully gone, that's okay. I'm gonna live with it. I'm gonna take it head on, because that's the way I do things. I'm not gonna be scared. I'm not gonna let fear control my life, because that's the enemy working on you. When you have fear in your heart or in your mind, that is the enemy. God would never allow that to happen to you. He will take care of you, and He promises to take care of you. So don't let fear. It will come in. It will come in. Inevitably, fear will creep into your heart or into your mind, and you need to immediately dispel it. Satan, get behind me. No way. Ain't happening. I'm going to have joy in my heart, and I'm going to have joy in my mind, and I'm going to keep on. So that's my message to everybody. Let me know if you like it, or what else you'd like to see. I have a lot of fun with my dog, so she's a big part of my life. That's Riley dog. And we have some squirrels, so that's kind of interesting about us, I guess. We're starting an apiary. We're going to start a bee farm. So we're going to see how that goes. That'll be in the springtime, I think. So we have chickens, but they all died eventually, which chickens do. So we're going to get some more chickens, and we're going to be just hanging out on our little urban farm here. So that's it. Let me know what you have to say. Good, bad, ugly, whatever. I can handle it. And I wish everybody out there the best of health and happiness.